Goni skill, wrist radial deviation. Position the patient in sitting next to a supporting surface with the shoulder abducted to 90 degrees and the elbow in 90 degrees of flexion. Position the forearm midway between supination and pronation so that the palm of the hand faces the ground. Rest the arm and hand on the supporting surface. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to radially deviate the wrist. Assess the forearm for supination or pronation and the elbow for flexion beyond 90 degrees. Radially deviate the wrist by moving the hand toward the thumb. Maintain the wrist in 0 degrees of flexion and extension. Stabilize the forearm to prevent supination and pronation and elbow flexion beyond 90 degrees. The end of wrist radial deviation range of motion occurs when resistance is felt and additional motion causes the elbow to flex. Assess the infield of the joint. This is usually hard because of contact between the radial styloid process and the scaphoid. The infield may also be firm because of tension in the ulnar collateral ligament, the ulnocarpal ligament, and the ulnar portion of the joint capsule. Tension in the extension carpi ulnaris and flexor carpi ulnaris muscles may also contribute to the firm infield. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The size of a smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer on the dorsal aspect of the wrist over the capitate. Align the stationary arm with the dorsal midline of the forearm using the lateral epicondyle for reference. Align the movable arm with the dorsal midline of the third metacarpal. Do not use the third phalanx for reference. Ask the patient to perform radial deviation of the wrist as done previously, maintaining the goniometer in alignment throughout the entire range of motion, and observe for any extraneous movements of the forearm and elbow. Read the degrees of motion on the goniometer and then ask the patient to return the wrist to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion, according to the American Association of Orthopedic Surgeons, is 20 degrees.